Turning 50 is an important stage in life. It is a time of experience, maturity, and reflection. Many people have already built a family, a career, and a life story filled with lessons learned. However, it is also a stage in which the body begins to show changes that require greater attention. One of the most common changes occurs in vision. It is common that after the age of 45 or 50, the need to use reading glasses appears. Increased sensitivity to light, difficulty driving at night, or a sensation of dry eyes may also develop. In most cases, these changes are part of the natural aging process. But there is an important reality that must be understood. Not all visual changes are normal. In some rare cases, certain almost imperceptible symptoms may be the first sign of a more serious problem, such as eye cancer. Eye cancer does not always begin with intense pain or total vision loss. In fact, it often starts silently, with signs so mild that they can be confused with the simple passage of time. That is why being informed is essential. This report aims to explain clearly and understandably what eye cancer is, what its most subtle early symptoms are, and why after the age of 50, we must pay special attention to changes such as blurred vision in one eye, shadows in the visual field, mild distortions that appear progressively. The goal of this information is not to create alarm, but to empower. What is eye cancer? Eye cancer occurs when certain cells inside the eye begin to grow uncontrollably. The most common type in adults is ocular melanoma, which originates in the pigment-producing cells of the eye. There are also other less common types. It is important to distinguish between two situations: cancer that originates directly in the eye, primary tumor; cancer that comes from another part of the body and spreads to the eye, metastasis. In this report, we will focus mainly on cancer that directly affects the internal structures of the eye. Although it is an uncommon disease compared to other types of cancer, early detection is key to preserving vision and improving prognosis. Why does the risk increase after age 50? As we age, our cells accumulate small amounts of damage in their genetic material. The immune system also loses some of its efficiency in detecting and eliminating abnormal cells. In addition, exposure to solar radiation increases over time. Environmental factors accumulate. Hormonal and metabolic changes occur. All of this slightly increases the risk of certain types of cancer, including eye cancer. This does not mean that all people over 50 will develop this disease, but it does mean that monitoring should be more careful. The silent warning sign: almost imperceptible symptoms. One of the most important characteristics of eye cancer in its early stages is that it may not cause pain. Many people expect a serious disease to cause intense discomfort. However, in this case, symptoms can be subtle. The most frequent early signs are: 1. Unilateral blurred vision. This is one of the most important signs. The person notices that one eye sees slightly more blurred than the other. They may think they need new glasses or that they are simply tired. What is characteristic is that it affects only one eye. Often, the change is so mild that the brain compensates for it and the person barely notices. A simple exercise is to cover one eye and then the other. If you notice a marked difference, it is important to consult a doctor. 2. Shadows in the visual field. Some people describe the sensation as a cloud, a spot, or a shadow that appears in a specific area of vision. It does not move like typical floaters. It is a fixed area. It may seem as if part of the image is slightly darkened. This symptom deserves special attention. 3. Mild distortion of images. Straight lines may appear slightly wavy. Doors or frames may seem distorted. This change may be very subtle at first. 4. Progressive decrease in central vision. If the tumor affects areas near the macula, the area responsible for detailed vision, there may be difficulty reading small print or recognizing faces. Why do these symptoms go unnoticed? There are several reasons. They are progressive, not sudden. They affect only one eye. They are confused with cataracts or presbyopia. They do not cause pain. In addition, many people avoid medical consultations out of fear or because they believe it is just part of aging. This is where the risk lies. Difference between normal changes and warning signs. It is normal after 50 to need reading glasses, have increased sensitivity to light, develop cataracts gradually. It is not normal to notice that one eye sees clearly worse than the other, see a persistent fixed shadow, perceive progressive distortion, have visual changes without a clear explanation. When a symptom affects only one eye, it always deserves evaluation. How is eye cancer diagnosed? Diagnosis begins with a complete ophthalmologic examination. The specialist dilates the pupil to observe the inside of the eye. They may use fundus examination, ocular ultrasound, optical coherence tomography, OCT, magnetic resonance imaging if necessary. In many cases, detection occurs during a routine checkup. That is why an annual exam is so important after age 50. Emotional impact of diagnosis. Receiving news of possible cancer generates fear. It is a natural human reaction. But it is important to remember, not all eye tumors are aggressive. Effective treatments exist. Early detection significantly improves prognosis. Many people continue to lead active lives after treatment. Information and proper medical guidance are essential. The importance of not ignoring small changes. The main message is clear. Early symptoms may be almost imperceptible, but small changes can make a big difference if detected in time. After age 50, listen to your body, observe your vision. Do not ignore new warning signs. Consult if you have any doubts. After age 50, the risk of certain tumors increases due to cellular changes accumulated over a lifetime. Although eye cancer remains uncommon compared to other cancers, its occurrence at this stage should not be underestimated. Ocular melanoma, uveal melanoma. It is the most common type in adults. It develops in the pigment-producing cells inside the eye. The uvea, where this tumor originates, includes the iris, the colored part of the eye, the ciliary body, which helps focus, the choroid, a layer rich in blood vessels. Most ocular melanomas develop in the choroid. This tumor may grow slowly for months or even years before producing evident symptoms. That is why it is considered silent. In its early stages, it may not cause pain, inflammation, or visible external changes. Intraocular lymphoma. This type of cancer is related to immune system cells. It can be mistaken for chronic eye inflammation because it produces symptoms such as persistent blurred vision, sensation of floating particles, inflammation that does not improve with conventional treatment. It usually appears in older adults and requires specialized studies for confirmation. Ocular metastasis. In this case, the tumor does not originate in the eye but comes from another organ. The cancers that most frequently spread to the eye are breast cancer, lung cancer, prostate cancer. Although this report focuses on primary eye cancer, it is important to know that the eye can be a window to systemic diseases. How is the best treatment determined? There is no single standard treatment for all patients. The medical team carefully evaluates tumor size, exact location inside the eye, whether it is near the macula or optic nerve age and general health condition, whether it has spread outside the eye. In people over 50, associated chronic conditions such as diabetes, hypertension, cardiovascular disease are also considered. The main goal is twofold: control the tumor, preserve as much vision and quality of life as possible. Current treatments explain simply: 1. Localized radiotherapy. This is the most commonly used treatment for small and medium melanomas. In brachytherapy, a small radioactive plaque is placed on the outer part of the eye, directly over the tumor area. It remains there for a few days and is then removed. This procedure delivers radiation directly to the tumor while minimizing damage to healthy tissue. In many cases, the eye is preserved and the tumor shrinks or stops growing. 2. High-precision external radiotherapy. Modern techniques direct radiation with millimetric accuracy. This reduces side effects and protects sensitive structures. 3. Surgery. When the tumor is very large or has caused severe complications, removal of the eye, enucleation, may be necessary. Although the word sounds frightening, today very realistic ocular prostheses are used that allow a natural appearance. It is important to understand that this decision is made only when strictly necessary to protect the patient's life. 4. Systemic treatments. If the tumor has spread, treatments such as immunotherapy, targeted therapies, chemotherapy may be used. These treatments aim to control the disease throughout the body. Possible side effects. All treatments may have side effects. In ocular radiotherapy, possible effects include dry eye, progressive decrease in vision, retinal changes. The medical team will schedule regular checkups to manage these effects. It is important to attend all follow-up appointments. Expanded prognosis. Influencing factors. Prognosis is not the same for everyone. Important factors include tumor size at diagnosis, cell type of melanoma, growth rate, presence or absence of spread. When the tumor is small and detected early, the chances of control are high. That is why monitoring is so important. The importance of long-term follow-up treatment does not end with radiotherapy or surgery. Follow-up includes periodic eye examinations, liver imaging studies, since ocular melanoma can spread there, blood tests, general health evaluation. Follow-up allows any changes to be detected early. Risk factors explained in more detail. Although there is no single cause, associated factors have been identified. 1. Prolonged sun exposure. Ultraviolet radiation may affect pigment cells. Wearing UV protective sunglasses is a simple but important measure. 2. Light skin and light-colored eyes. People with less pigmentation have a slightly higher risk. 3. Age over 50. Risk increases over time due to accumulated cellular damage. 4. Family history. In rare cases, there is genetic predisposition. Deeper emotional impact. A diagnosis may generate thoughts such as, will I lose my vision? Is it fatal? How will this affect my independence? These concerns are completely normal. It is essential to seek clear and reliable information. Speak openly with your doctor. Rely on family support. Consider psychological support if necessary. Emotional well-being directly influences recovery. Quality of life after treatment. Many people continue driving, reading, working, enjoying social activities. If vision decreases in one eye, the other can compensate significantly. Visual aids and rehabilitation are available if needed. Life does not stop. Signs requiring immediate attention. After age 50, seek medical evaluation without delay if you experience sudden vision loss, persistent fixed shadow, progressive distortion in one eye, change that does not improve with new glasses, noticeable difference between both eyes. Do not wait for the symptom to worsen. Practical prevention in daily life. Wear UV protective sunglasses. Have an annual eye exam. Control chronic diseases. Maintain a balanced diet rich in antioxidants. Avoid smoking. Stay physically active. Small actions have a great impact. Eye cancer is silent in its early stages. It does not hurt. It is not always noticeable. It does not always give obvious signs, but it may begin with something as simple as slightly more blurred vision in one eye, a mild shadow in part of the image, an almost imperceptible distortion. After age 50, paying attention to these small details is essential. It is not about living in fear. It is about living with awareness. Early detection allows less aggressive treatments. It allows preservation of the eye. It allows preservation of quality of life. And in many cases, it allows saving a life. Listen to your vision. Observe subtle changes. Consult without fear. Information is protection. Prevention is wisdom. And timely care is an act of self-love.